I was having coffee with a friend last week. She was quiet, stirring her drink long after the sugar had dissolved. Finally, she looks up at me, and her voice is almost a whisper when she says, "I think he's hiding something." My mind immediately jumped to the usual places, the late nights at the office, the way he angles his phone away from her, the classic tired story of a coworker. I was about to ask the obvious question, do you think he's seeing someone else? But I stopped, because I remembered reading this study, this look into what people asked when they think no one is listening. And in the total, anonymous privacy of a Google search bar, is my husband having an affair, isn't even the number one, is my husband question. The top search by a significant margin is my husband gay? What's fascinating and kind of heartbreaking is where that question is asked the most. The search rates are highest in the states with the least support for gay marriage. It's this perfect secret snapshot of a question you can't ask your friends, you can't ask your family, but you will ask the internet. It turns out that Little White Search Bar is the most honest confessional booth humanity has ever invented. And the data it collects is painting a picture of who we really are, not who we pretend to be in surveys, or even to our friends. And that really is our mission today. We are taking a deep dive into the world of unfiltered data, the anonymous truth captured by search engines and massive data systems, and asking, what happens when we leverage this raw, anonymous knowledge to inform society, policy, and crucially, the algorithms that decide our opportunities? It's a journey into the hidden self of society, revealed by the questions we dare not speak aloud.
It's an essential examination of humanity when the social mask drops. I mean, the sheer volume of data we generate, and predictions suggest we'll hit, 163 zettabytes by 2025? It's just transforming every sector, from public health to justice. But this transformation introduces a radical tension. We have to grapple with what that raw data reveals and how systems built on it affect real lives, often impacting the most vulnerable among us first.
We've distilled this discussion into three key dimensions based on the material we have examined. First, we look at hidden needs. The incredible capacity of this data to bypass deep-seated social stigma and expose uncomfortable truths people won't self-report, particularly around health crises. It gives us like a real-time window into public distress.
And second, we have to address algorithmic bias. This is the profound challenge of making sure that this massive volume of data doesn't just validate and, amplify existing systemic problems like prejudice and poverty. It requires us to move beyond simply analyzing data to actively dismantling the inequality that's baked into our historical records.
And finally, we confront the societal double-edged sword. This is the danger that exposing these uncomfortable societal truths, even if they're factual and sourced from deep data, can sometimes deepen polarization and fear. It doesn't always foster the necessary productive dialogue and systemic correction we desperately need. It's a powerful mirror, sure, but mirrors don't always inspire positive change.
Okay, let's unpack this core concept first. Why is search data such a uniquely powerful tool compared to all the traditional research methods we've relied on for decades? It really boils down to one thing: the pervasive, fundamental failure of traditional self-reporting.
Exactly. When researchers rely on traditional methods, whether it's a political poll, a health survey administered by a doctor, or even an anonymous questionnaire handed out on the street, you run directly into what behavioral scientists call social desirability bias. Humans are social creatures, and we are constantly performing a version of ourselves we want others to believe. And that performance doesn't stop just because the survey says anonymous. We instinctively know what society deems good or acceptable, and we adjust our answers, we exaggerate the positive behaviors, how often we exercise, how much we donate to charity, how good our sex life is, and we minimize the negative ones. Things like substance use, politically unpopular views, or feelings of deep anxiety.
This distortion is universal. Think back to major elections where pollsters consistently underestimated the support for certain candidates. That unexpected shift in the final vote count, sometimes attributed to late deciders, is often just the manifestation of voters being embarrassed or, reluctant to admit their preference in a high-stakes social survey environment. They lie, or maybe they manage their self-presentation to the pollster, but not to the voting booth.
The internet changes the entire behavioral calculus. In that private, solitary moment with search bar, that need for social performance it vanishes. You're not talking to a pollster or a doctor or even a digital assistant with a voice. You're whispering a question into the ultimate digital void. The data confirms people ask questions they literally cannot ask in real life because the stigma is too high or the question is too vulnerable.
And we see this reflected in the raw volume of searches. The data is shocking because it shows our true priorities. Searches for porn consistently exceed searches for weather in certain global regions. This isn't a moral statement. It's a data point indicating immediate private human interest supersedes basic public needs when people feel truly alone with their curiosity.
Or the highly classic, and frankly very human, searches by men asking Google about their penis size. They don't pull out a ruler and measure it. They ask Google, hoping for an average, seeking validation or comparison immediately. These are the kinds of immediate, personal, often insecure questions that reveal who they are when no one they believe is watching.
And critically, this capacity for unmasked truth is not just fodder for fascinating cultural observation. It is vital for understanding and improving public health and welfare, especially in areas fraught with stigma.
Here's where it gets really interesting. Let's return to the search data surrounding hidden stigma, particularly mental health and substance use. It's a perfect use case for this kind of infovalence. We mentioned that heartbreaking finding that "Is my husband gay?" is the top search in its category, 10% higher than the classic "Is my husband cheating?"
Yes, and that finding is acutely linked to social geography. This search pattern peaks significantly in states with the least supportive policies for gay marriage and with deeply conservative social norms. This is a perfect demonstration of a hidden crisis fueled entirely by societal repression. Where the social cost of identifying as gay is high, men may conform by marrying women, and their wives, who feel unable to confront the truth publicly or even privately within their rigid social structure, turn to Google out of suspicion, confusion, and despair.
It's essentially a statistical index of societal repression. But the public health application extends far beyond identity. I mean, think about how public health officials traditionally measure distress, like depression or substance abuse. They rely on official self-reported rates from surveys and clinic visits.
Right. And consider a scenario where an official is looking at her state's data. She sees that in the rural communities, the classic pull yourself up by your bootstraps strongholds, the official rates for clinical depression and anxiety are the lowest in the state. On paper, these communities are the most resilient, the healthiest.
But when that official looks at the anonymized, aggregated search data coming from those exact geolocated areas, the picture is horrifyingly different. They weren't reporting anxiety or depression to the clinic. They were performing secret searches like, why do I want to drink every morning? How to stop hands from shaking? And the profoundly sad one, I feel nothing.
The unfiltered search data is absolutely vital because it bypasses the cultural stigma associated with being seen as weak or needing psychiatric help. In those highly self-reliant, pull yourself up by your bootstraps environments, the search bar became the only place where that despair could be expressed without social consequence.
That's a powerful difference, the difference between a lagging indicator, like clinic visits, and a leading indicator, which is the secret searches. So how do researchers actually connect those raw, desperate searches to actionable public health policy?
This leads us directly to the concept of infovalence, which is the use of internet-based data to monitor public health trends. Researchers have definitively shown the potential of using internet search queries as an infovalence tool to predict the demand for substance use treatment, both spatially and temporally. It's especially powerful for substance use disorders, SUDs, and the opioid epidemic.
So how do they track this? Are they using individual people's search histories? Because that sounds problematic.
No, the data is aggregated and anonymized, but it retains key features like timestamps and general geolocation markers, like a zip code or a county. Researchers analyze search clusters, so queries using terms like quit, stop, rehab, or detox for alcohol, or specific drug names paired with help-seeking terms. Then they compare these search rates to the official traditional data on who is needing but not receiving specialty treatment.
And what did that association tell us specifically about alcohol abuse treatment needs?
When they analyzed alcohol-related help-seeking searches, they found a statistically significant positive association with the number of people needing but not receiving treatment at a specialty facility. The correlation was really tight. A 1-unit increase in the alcohol-related help-seeking search variable, which translates to 1 additional search per million searches, approximately corresponded to a 1% increase in the expected rate of people needing but not receiving treatment.
Wow, so that means the search data is functioning as a real-time warning system.
Precisely. Official surveillance mechanisms, like overdose statistics or insurance claims, often have significant time lags. We're talking 6 months to a year. And that hinders a real-time response to rapidly evolving crises like the opioid epidemic. Search data provides a leading indicator of unmet need, allowing health agencies to allocate treatment resources, plan outreach, and deploy mobile clinics proactively. They can target the exact geographical hotspots where secret despair is spiking.
And beyond public health, we can use this data to unmask hidden biases and political sentiment that people are, reluctant to admit to in public.
Absolutely. The honesty in the search bar extends deeply into uncomfortable political and social territory. One landmark study examined search data related to racism using highly specific racially charged terms and found that areas with the highest rates of these specific searches correlated directly with a lower vote share for Barack Obama compared to the previous white Democratic candidate.
And what was the measurable impact of that hidden sentiment, the stuff that traditional polls completely missed?
The analysis suggested that racism, as captured and revealed by the anonymous search data, cost Obama approximately 4 percentage points nationally in the election. That's an impact far higher than any predictions based on traditional opinion surveys. This confirms that the search bar captured a widespread, uncomfortable anger and prejudice that was real, measurable, and ultimately influenced national outcomes, even if citizens would never admit to it on a recorded phone line.
So the data reveals these hidden undercurrents of the electorate. And the key then is understanding how that revelation impacts the community itself. Because this hidden data, when it's publicly exposed, it doesn't always lead to positive, informed change.
That's the critical pivot. We have to consider the ethical dilemma of transparency. Think of the Purple Town scenario. It's a fictionalized but highly realistic case study of polarization. You have a geographically tight community that is politically divided almost down the middle. A local journalist gets access to highly localized, anonymized search data and sees two disturbing, seemingly contradictory trends spiking at the same time.
Okay, what were those trends?
On one side, residents who are searching for hyper-specific, racist conspiracy theories and veiled threats against local officials, reflecting extreme anti-government sentiment. On the other side, residents, perhaps the officials themselves or their supporters, were searching for how to buy body armor, is my neighbor a threat, and specific types of weapon permits.
So the data confirmed a community locked in a cycle of mutual fear and suspicion. They had moved beyond disagreement and into genuine private paranoia.
Exactly. And the journalist, believing she was performing a public service by providing this crucial unfiltered information, publishes an article titled, "What Our Town is Really Searching For: Fear and Hate in the Suburbs."
And what was the immediate result of holding that mirror up to the community?
It did not shock people into dialogue or reconciliation. Not at all. Instead, it became a divisive, algorithmic narrative that deepened polarization. The exposure of the truth simply gave both sides confirmation bias. One side saw the data as definitive proof that their neighbors were hateful and dangerous extremists. The other side saw the article as definitive proof that they were surrounded by enemies, the media, their neighbors, local officials, who were spying on them. The data, divorced from a pathway for reconciliation, simply fueled fear, mistrust, and withdrawal. This perfectly demonstrates the double-edged sword of exposing societal truth. Truth alone is not enough to foster healing. That polarization story is a necessary bridge into our second major dimension, the profound challenge of algorithmic bias. The moment we start applying this powerful, often raw and emotionally charged data to automated systems like credit scoring, hiring portals, or criminal justice risk assessments, we confront the dangerous fallacy of objective data.
We hear the term data fundamentalism a lot, and it suggests an almost religious faith in numbers. It's this pervasive but dangerous belief that because big data involves high complexity, petabytes of information, and computational rigor, it must therefore be objective.
This assumption is fundamentally flawed. Data fundamentalism ignores the fact that data sets are snapshots of the past, and a past that's often riddled with systemic inequality and human bias. A seminal report from the White House, looking specifically at algorithmic systems and civil rights, warned that big data runs the critical risk of encoding discrimination in automated decisions.
So discrimination isn't necessarily being programmed in explicitly.
No.
But it becomes the inadvertent yet inevitable outcome of how these massive data technologies are structured and used.
Precisely. The scale of the data is impressive, yes, but the quality and context of that data determine the ethical outcome. And often the context, the historical record of human decisions, is deeply problematic.
This brings us back to that classic, crucial anecdote of the poverty predictor. A PhD student working on an ambitious project aims to build a technically flawless machine learning model to predict criminal arrests in a large metro area. And they managed to develop an algorithm that boasts a stunning 92% accuracy score.
And the professor, who has that essential ethical lens, asks the crucial question. The math is perfect. But tell me, what factors did your model find most predictive? This is where the model completely failed its ethical premise.
The algorithm hadn't predicted criminality at all.
No, it was predicting poverty. The model had simply identified socioeconomic status by heavily weighting highly specific, seemingly neutral search terms, things like payday loans near me, nearest food bank, and free legal aid.
It was technically the most sophisticated poverty predictor the university had ever seen, but it was designed to predict arrests. This is that moment where we realize the danger of optimizing for efficiency without incorporating human wisdom.
Right. The algorithm didn't tend to discriminate, but by using seemingly neutral inputs like online search history, it perfectly encapsulated and amplified systemic socioeconomic bias.
But wait, if the algorithm achieved 92% accuracy in predicting who would be arrested, how is that not also predicting criminality? I think that's where some people get stuck.
Because arrests are not crimes. That's the key distinction. Arrest data is a reflection of policing practices and the historical focus of law enforcement resources, which are disproportionately directed toward low-income communities. The model was simply predicting where the police would be and therefore where arrests would statistically occur. If the student had optimized the model to predict convictions or self-reported crime victimization, the inputs might have been different. By relying on arrest data, they built a bias feedback loop right into the core of the prediction. This highlights that optimizing for a flawed metric, even if it's mathematically accurate, is the root of algorithmic harm.
Okay, let's break down the mechanics of how these flaws get embedded into algorithmic systems, starting with the inputs themselves.
Right. Challenge one is flawed inputs. These are the decisions made early in the design phase, what data to include, what to ignore, and how to define success, that inevitably result in discriminatory outputs later.
And a key example of this is selection bias. When the data set you're using isn't representative of the population you're trying to analyze, the conclusions get skewed, and the system fails to serve everyone equally.
Think about urban planning guided by GPS traffic data. If that data is primarily collected from people who own the latest smartphones and regularly use navigation apps, the results may be far more accurate for affluent, device-heavy populations. In contrast, those who rely on older technology, public transit, or simply walk, often lower-income or elderly residents, are underrepresented. This can lead urban planners to unknowingly create transit deserts or neglect infrastructure improvements in areas that are invisible in the dataset.
And we also have the pervasive danger of perpetuating historical biases. These are systems trained on past employment patterns, credit history, or social behaviors that just inevitably reinforce old inequalities.
Consider hiring. Many companies emphasize finding a good culture fit. When an algorithmic system is tasked with finding candidates for culture fit, it analyzes the data of current, successful employees, their schools, their interests, maybe even where they live, and then recommends candidates who match that profile. If the existing workforce is predominantly, say, young white men from specific university backgrounds, the algorithm, no matter how clever, simply replicates that bias. It reinforces historical inequality by favoring those who resemble the historical norm.
That moves us to challenge two, the black box design itself. For anyone outside the technical development process, the end result of a large-scale data system, a credit application denial, a medical risk score, a job rejection, it just feels like an opaque machine.
That opacity is often deliberate. It's driven by intellectual property rights, as the underlying systems are treated as confidential or proprietary to the companies that develop them. This lack of transparency means that the affected individuals, the applicant denied credit, the student rejected from a program, have extremely limited ability to learn why the adverse decision was made, or to detect and seek correction of any errors or systemic bias that may have occurred.
It strips the individual of autonomy and recourse?
It does. And in some cases, these opaque systems, matching systems like ad platforms or job boards, can restrict opportunities before the individual even knows they exist. They can limit certain groups from seeing advertisements for high-paying jobs, competitive financial products, or exclusive educational opportunities based on data proxies that are not legal grounds for discrimination. This creates invisible barriers to opportunity and restricts social mobility, all while claiming optimization.
We have concrete, high-stakes case studies in systemic discrimination proving this is not just theoretical. Look at healthcare, where the stakes are literally life and death.
Absolutely. The Obermeyer study, a landmark piece of research, exposed an algorithm widely used by a healthcare provider to predict which patients would benefit most from extra medical care, a program designed to allocate scarce resources proactively.
But the algorithm was found to be biased. How did that happen, technically?
Well, The designers optimized the algorithm to predict which patients would have the highest future healthcare costs. They assumed that higher future cost was an excellent proxy for higher medical need. However, because of systemic racial disparities in the U.S. healthcare system, where Black patients often receive less aggressive treatment and fewer follow-up appointments than white patients for the same chronic conditions, Black patients incurred lower future costs.
So the algorithm read the lower cost as lower need.
Correct. The algorithm mistakenly assigned lower risk scores to Black patients, concluding they were healthier than they actually were. This systematically led to them receiving less priority for the specialized care program compared to white patients with the exact same measurable health conditions. The system was technically perfect at maximizing for cost efficiency, but completely failed at maximizing for health equity.
That's a powerful illustration of a harmful proxy at work. And we see similar problems in employment using metrics that seem entirely neutral but function as proxies for protected classes.
Yes. For example, employment research firms discovered that commuting distance was an extremely strong predictor of job performance and employee retention, particularly in customer service roles. People who lived closer tended to stay longer and perform better.
So if an algorithm were trained on past retention data, it would naturally start weighting against candidates who live far away. That sounds like good business sense. Why is that considered a problem?
Because in many dense urban areas, commuting distance serves as a powerful non-legal proxy for protected characteristics like race or income level. Due to historical housing segregation and economic disparities, low-income or minority candidates are often forced to live further from major commercial job centers.
So if you algorithmically screen out all candidates with a 90-minute commute, you are statistically excluding large segments of the minority population who are otherwise qualified.
Precisely. In the specific study we examined, the firm ultimately disregarded commuting distance as a factor precisely because of that ethical and legal concern, even though its predictive power was high. But the crucial point is that in the black box environment, many employers operate in ignorance of these systemic connections, unwittingly implementing racially or economically discriminatory practices through seemingly benign distance metrics.
And finally, we have the critical and increasingly complex question of liability. As these AI systems become more autonomous and make decisions outside of direct human oversight, assigning responsibility for mistakes becomes, well, very difficult.
It becomes a critical public policy challenge. The World Economic Forum notes that the liability issue is massive because the chain of command and accountability, who is responsible for the system's unintended decisions, is broken.
We remember the basic examples, like the known case where Apple Maps had a flaw in its bike routes in Amsterdam and directed tourists through a tunnel on a high-speed highway, endangering their lives. The tourists held Apple responsible.
That's straightforward because the error was rooted in map data, a human data entry error, essentially. But as AI systems become fully autonomous, making decisions based on complex, proprietary predictive models, who is liable when a system denies a loan to a minority-owned business based on a biased proxy variable? Or when a self-driving car makes an unexpected harmful choice? Was it the programmer, the company, the data scientist who selected the training data, or the autonomous system itself?
The complexity just multiplies when the error is not a simple data flaw, but the result of the system's emergent properties, unpredictable outcomes generated by the sophisticated interaction of billions of data points.
Exactly. And the lack of auditability in the black box means we often can't even tell why the error occurred, making it impossible to assign liability or provide adequate recourse for the victim. If we can't audit the decision, we can't regulate the system, and that puts corporate efficiency far above civic protection.
So if the problem is that our systems are encoding historical bias and amplifying societal fractures through flawed data and opaque algorithms, the solution has to start at the design phase. We need a concept of equal opportunity by design.
This principle requires a fundamental shift in engineering mindset. It means embedding fairness, transparency, and safeguards against discrimination from the very first step of engineering a system. We cannot wait until the system is deployed and causing harm to perform an audit. We have to build systems that actively promote fairness and equity proactively.
That requires designers to actively question the assumptions built into their own datasets, rather than just optimizing for efficiency or speed.
Absolutely. This means designers must actively engage with bias mitigation research. They need tools and training to prevent encoding their own cultural assumptions and unconscious biases into the systems. Because designers, like all humans, are products of their culture and experiences. Their biases, if left unchecked, will be reflected in the technology they build simply because they view their own demographic experience as the universal norm.
Moving into specific applications, let's look at the financial sector access to credit. Big data presents both an enormous opportunity to correct historical wrongs and a massive risk of creating new ones.
The problem starts with the credit invisibles. According to the Consumer Financial Protection Bureau, 11% of consumers are considered credit invisible, meaning they don't have enough credit history for an algorithm to produce a traditional FICO score. Without a score, they can't access affordable mainstream credit.
And that figure skyrockets to 30% in low-income neighborhoods. This isn't because they are irresponsible, it's because the system doesn't capture their behavior. Since African Americans and Latinos are statistically more likely to be credit invisible, this lack of scoring prevents millions of people from accessing affordable mortgages, car loans, or starting small businesses, trapping them in high-cost alternative financing markets like payday loans.
The big data opportunity here is profoundly compelling.
Yeah.
Using alternative data to score these individuals. We know that many Americans, especially in low-income brackets, regularly pay their rent, phone bills, and utility bills, which are strong indicators of creditworthiness. Yet this payment history is generally only reported negatively when they fall behind, but not positively when they pay on time to credit bureaus.
Why are those payments only reported negatively? Why wouldn't utility and telecom companies want to give people credit?
The current system is geared toward debt collection, not credit facilitation. Utility companies are not fundamentally financial institutions. They benefit when debt is collectible, but they have no direct incentive to improve a consumer's credit score, which would allow them to leave the low-income rental market and potentially move out of the service area.
But if we were to incorporate this alternative data, what's the potential impact?
If both positive and negative utility and telecom payments were included in scoring models, studies suggest that over 70% of unscorable files would become scorable, and 64% of thin files, those with very little history, would see improved scores. This change specifically benefits low-income and minority borrowers, potentially unlocking billions in affordable credit access.
That sounds like a powerful tool for social mobility. But where does the double-edged sword come in?
The risk is the introduction of new, highly invasive and often highly inaccurate proxies that reinforce existing disparities or create new ones. We are already seeing companies exploring hyperspecific new data sources, information gleaned from social media connections, location data derived from cell phones, purchasing preferences, and even micro-behaviors like the speeds at which applicants scroll through personal finance websites.
So if I live in a community that is already disconnected from mainstream lending, using my social media network to judge creditworthiness might just confirm that I lack the right connections to get a loan.
Exactly. The system judges based on existing disparity. Furthermore, we have to address the data accuracy issue. Even with traditional, long-collected credit data, 21% of consumers have a confirmed error on at least one credit bureau report.
Yeah.
Now imagine expanding the data sources to include fast-changing, high-volume, noisy data like scrolling speeds, social media usage, or moment-to-moment location tracking.
That kind of ephemeral data seems impossible to verify or audit.
It is. This expansion will only exacerbate the presence of factually inaccurate data, making it exponentially harder for consumers to dispute or correct adverse decisions made in the increasingly opaque black box. The opportunity for expansion comes with the profound responsibility for accuracy and redress that the current system is not equipped to handle.
This tension using data to expand opportunity versus using data to entrench new forms of discrimination is mirrored perfectly in our education and justice systems.
In higher education, we see powerful examples of both sides. Georgia State University's Graduation and Progression Success, or GPS, advising program is a stellar example of positive, proactive data use. This system tracks over 800 different risk factors for each student daily.
800 risk factors? What kind of detail are we talking about?
Everything from dropping a prerequisite course, failing to register for the next semester's classes by a certain date, or even consistently ignoring advisor emails. When the system detects a potential problem, it triggers proactive advising and timely interventions, customized to the risk factor. They aren't waiting for the student to fail. They intervene when the data suggests they're about to fail.
And the results were overwhelmingly positive. Their overall graduation rate increased by 6 percentage points. But critically, the biggest gains were enjoyed by the students who needed it most. First-generation, Black, and Latino students, as well as Pell Grant recipients. For the first time, these at-risk groups graduated at rates at or above the student body overall. The data helped them support students who historically faced systemic obstacles.
But here is the critical danger we discussed earlier. The very same data that correlates with student success and the need for proactive intervention also correlates with low family income and the need for extra institutional resources. The discriminatory risk is that administrators facing budget cuts could use that exact same predictive data not for support, but to deny admission to students deemed statistically less likely to graduate without massive, costly intervention.
So the supportive tool becomes a selective gatekeeper, making access a function of predicted resource consumption rather than potential.
Precisely. The goal shifts from maximizing student opportunity to minimizing institutional risk and cost. The data serves as a justification for exclusion rather than a roadmap for inclusion.
Moving to criminal justice, predictive policing presents a similar duality. Law enforcement agencies have long tried to identify corrupt patterns, and new technologies can certainly enhance efficiency and transparency, allowing officers to be deployed more effectively to high-risk areas.
The challenge arises when historical arrest data is used as the foundational input for these predictive algorithms. We have to remember that underlying criminal justice data is notoriously poor and subjective, heavily influenced by officer discretion on whom to stop, search, question, and charge. It reflects historical policing patterns, not necessarily objective crime rates.
If a machine learning system is trained on those biased past arrests, it creates the perfect feedback loop we mentioned earlier. Let's break that down into steps for the listener.
Step 1. The algorithm, trained on historical data, sees a high density of past arrests in Community X. It advises beat officers to patrol Community X with greater frequency or intensity.
Step 2. Increased policing intensity in Community X leads to an increase in arrests, often for minor discretionary crimes like loitering or nonviolent drug possession, simply because there are more eyes looking for them.
Step 3. This new arrest data is fed back into the algorithm. The system interprets this increase as a confirmation of its initial prediction. It then reinforces the bias, leading to even more intense patrols in Community X in the future.
The system creates a self-fulfilling prophecy. The algorithm perpetuates policing practices that disproportionately target specific, often low-income or minority communities, even if the underlying community may have improved over time or if crime rates have shifted elsewhere.
And this loop reinforces the notion that the problem lies entirely within that specific community, masking the systemic problem of biased data input and allocation of enforcement resources.
So whether we are talking about credit, education, or justice, the core problem is that we've been focused on maximizing the technical capability and the mathematical accuracy of data without sufficient attention to the ethical consequences of the questions we are asking or the systemic bias of the data we are feeding the system. And that brings us to the necessary changes in data science education.
That is the crucial pedagogical shift needed to escape this systemic reinforcement. The data science anecdote we discussed, the PhD student who built the poverty predictor, highlights the urgent need to prioritize critical thinking and innovative problem formulation over mere data volume. As one expert noted, the size of the data set is often overrated. The important thing is asking the correct, ethical, and contextual questions.
But isn't industry demanding sheer speed and technical proficiency over philosophical reflection? I mean, how realistic is it to ask a student to prioritize problem formulation when the job market rewards engineers who can simply handle a massive data load quickly?
That tension is absolutely real, and it's why systemic change is required. Our sources concern this curriculum deficiency. Current data science programs often focus primarily on technical skills, reflecting immediate industry practice and priorities with limited inclusion of ethics. Specifically, quantitative courses tend to lack scholarly or practical literature on data ethics. Ethics is often bolted on as an optional seminar.
So the goal isn't just to add a single non-mandatory ethics seminar at the end of a technical degree.
No, it has to be deeper and integrated. Ethics training must be reframed to go beyond simple concepts like informed consent or data privacy. It must actively address the systemic power dynamics embedded in technology, who benefits and who is harmed by the design choices. We need to foster critical data literacy.
What does critical data literacy look like in practice for an engineer?
It means understanding that every design decision is a moral decision. It means challenging the objective function like asking if maximizing for cost efficiency is acceptable if it comes at the expense of health equity. It means understanding the context of the training data, recognizing that historical arrest data is not objective reality, but a reflection of systemic bias. We need to move away from the idea that knowledge is purely technical and toward the idea that knowledge is most valuable when understood and applied responsibly, ensuring the engineer understands the difference between predicting arrests and predicting poverty. When we look at the entire arc of this data revolution, from the search bar confessional to the autonomous algorithm, the picture is clear. We're living through an unprecedented moment where we have access to the raw, unedited truth of society, bypassing all traditional masks, revealing hidden crises in public health, and exposing our deepest insecurities. This data is an invaluable tool for profound social good.
But that same honesty carries with it the profound risk of encoding our worst historical prejudices into complex systems of control. Data fundamentalism, that unquestioning belief in the objectivity of scale, is a critical hazard that could lead to new forms of discrimination, more insidious and pervasive than anything we've seen before, because the bias is embedded in the math itself.
The future demands that we marry the powerful potential of this data to serve public health in secret, expand credit access, and support student success with human wisdom, governance, and critical thought. We must commit to designing systems that ensure transparency, accountability, and ethical application from the outset. We need engineers and policymakers who understand that the mirror of truth revealed in the search bar must ultimately serve the purpose of equal opportunity and autonomy for all. We have the data. The challenge now is to find the wisdom to use it for systemic correction, not systemic reinforcement.